Kenya's second round of vaccinations got a major boost with the arrival of 72,000 doses of the Astra-Zeneca Covishield vaccines from South Sudan. The vaccines, which arrived at the JKIA at 5:15 p.m. this evening aboard a Kenya Airways flight KQ352, were received by Ministry of Health officials and delivered to the National Vaccine Depot in Kitengela. Dorcas Wangira with the details.
72,000 doses of the Astra-Zeneca vaccine Covishield from South Sudan, which were received by Kenya as part of the COVAX vaccine dose sharing strategy that has countries with logistical challenges, hesitancy and lack of infrastructure give back vaccines to the mechanism and later have the vaccines redistributed to other countries with adequate capacity to administer them before they expire. The doses were in 7 packages, each weighing about 318 kilograms, stored between 2 to 8 degrees and have a shelf life of up to July 17th. South Sudan received 132,000 doses of the vaccine in late March from COVAX, the global initiative to ensure lower-income countries receive jabs, but so far has administered less than 8,000 shots. South Sudan failed to use its doses because of a slow initial uptake by health workers, delays by Parliament to approve the vaccine's use, and a lengthy training of people to administer the vaccine. Previously, the Ministry of Health had disclosed that Kenya would receive up to 130,000 doses of vaccines from Congo DRC. However, this was halted by COVAX owing to Kenya engaging bilaterally with DRC to secure the vaccine instead. COVAX's plan is to have countries donating back their vaccines to prioritize immediate neighboring countries first before donating to other countries from other regions. According to the WHO regional coordinator, Africa requires an additional 200 million doses of COVID-19 vaccines to immunize about 10% of the African population by September. Less than 2% of the world's COVID vaccines have been administered in Africa. The continent is staring at the possibility of new surges, hence the need to speed up immunization of vulnerable segments of the population like the elderly and terminally ill. Further, the continent requires at least 20 million Oxford AstraZeneca COVID-19 vaccine doses in the next 6 weeks to enable the continent to deliver second shots to populations that had received their first doses.
As WHO, we are appealing to countries that have already vaccinated their high-risk groups to significantly expand and bring forward their pledges and actions to share doses.
The ongoing vaccine crisis is a scandalous inequity that's perpetuating the pandemic. More than 75% of all vaccines have been administered in just 10 countries. There is no diplomatic way to say it. A small group of countries that make and buy the majority of the world's vaccines control the fate of the rest of the world.
Kenya, from Monday, will continue administering the second dose of the vaccine from the vaccines mopped up from the regional stores in the counties and the donated doses. On Friday, 28th May, more than 100 healthcare workers received the second shot in the arm at the Kenya National Hospital. In the last 24 hours, 444 people have tested positive for COVID-19. From a sample size of 4,989, the test positivity rate is 8.9%. 17 deaths have been recorded, bringing the fatalities to 3,141. So far, 968,733 people have been vaccinated. The Ministry of Health urging Kenyans to go for the second dose only upon being alerted by the chanjo system. Dorcas Wangira, Citizen TV, Nairobi.